Aside from economic and social issues, the physical well-being of Cebuanos and Filipinos must also be well taken care of in order for us to have a healthy, resilient, and livable communities. Brenda Granada and her sister Elsa Tapik can still vividly recall the pain of knowing that they have been diagnosed with stage 2 breast cancer.
Siguro mga 9 years, but I never mind about it.
Upon knowing that I have a lump, I consulted doctor. After mga 15 days, the result was stage 2 breast cancer. So upon knowing it, I cried a lot.
Elsa is a teacher by profession while Brenda works for the government. Both were financially struggling at the time. But their worries eased upon learning that the RAFI Eduardo J. Aboitis Cancer Center can help with their predicament.
Our chances of winning the battle is actually higher if we start our battle with awareness and screening for early detection. It's basically teaching them how to do pap smear and clinical breast exam. During the last 3 years, for example, we were able to serve 270 Cebuanos for treatment and more than 14,000 Cebuanos for screening.
Another pillar program caters for physical well-being is the RAFI Dolores Aboitis Children's Fund.
RAFI DASEF enables communities to champion for children to reach their full potentials.
According to the Philippine Statistics Authority, or PSA, 31% of Filipino children are born poor.
Early childhood is really the formative years of children. It is very important for us to invest on these years because it has a lasting impact of a person's development.
All these undeserved children only need a fighting chance, which RAFI DASIF provides in the form of early education, psychosocial development, and health and nutrition program grants, collaborating with different local government units and organizations, one of which is the SOS Children's Village in Cebu.
We always believe that raising children would really take a village. And DASIF is one of our village communities, helping our own communities as well.
And over the past decade, the RAFI DASIF has successfully reached out to underserved children through their 148 child development centers found all over Cebu and parts of the Visayas and Mindanao, even continuing on with their good work despite the COVID-19 pandemic.
We gave out more than 10,000 children some care packages. We were also able to provide medical support for children with COVID.
The RAFI 1 to 3 program is a reforestation advocacy which offers community-based and environmentally appropriate native tree growing services, partnering with local farmers for the maintenance of trees and well-known responsible brands in the country. Growing more than 8.6 million trees and 1.2 million mangroves in more than 10,000 hectares of land in Cebu since 2017.
We truly believe in tree growing because it goes so much further than just planting a seedling. It's about growing trees and making them sustain themselves and survive just simply past the seedling stage, and that's one thing we pride ourselves on.
The impact of the COVID-19 pandemic was unprecedented, but always ready to help is the Ramon Aboitis Foundation.
Since the complexity and the impact of the various disasters have really been increasing over the past years, the Humanitarian Disaster Preparedness and Response, or HDPR program of RAFI, was developed.
Some programs include the distribution of relief goods through the Adopt a Barangay 2.0 program, free ambulance access to COVID patients, the provision of PPEs, free shuttle and free accommodation for frontliners, mobile bloodletting drives, the Comunidad contra COVID communication campaign, and providing portable hand-washing stations for barangays. The Physical Wellbeing Program set in motion by RAFI is their commitment in building a healthy, livable, and resilient communities, not just for their partner beneficiaries, but for all Filipinos.
We use the metaphor of an architect because the architect comes in and he works with people. They ask questions, they understand the landscapes, but at the end of the day, we turn over the project to the community. We turn over the project to the organization, and really it's theirs, and they have that sense of ownership over the project.